So one of the most common questions that get asked, of course, is what's the cost associated with scoliosis treatment? And there's a lot of costs associated with scoliosis treatment that most patients should be aware of. One obviously is the financial costs, and which I'll be discussing in a second. But really what people should be thinking about is what's the cost of a negative outcome, especially when it comes to conservative treatment, something that we're dealing with when we're trying to avoid something that's much more expensive in terms of surgery. And of course, what's the cost of getting no treatment at all? What that can lead to a scoliosis patient as they're possibly progressing over time. When it comes to scoliosis, there are really two main approaches. And one is something called the traditional approach to scoliosis treatment, which is more like the watch and wait, more like traditional bracing, and of course, allowing the curve to progress to a point where surgery can sometimes become an option. And then there's the opposite approach, which is something called a conservative approach to scoliosis. And that's what's done at Scoliosis Reduction Center. Now, this conservative approach is deviant from the traditional approach, but not completely. It kind of takes this traditional approach that uses more ineffective tools and it customizes to make that more traditional approach, the before surgical realms, to make it much more effective for the patient to avoid surgery. So when we talk about traditional treatment, first thing is watch and wait. It's the most common practice that traditional approach does is. And what's the cost associated with not getting treatment when they're doing the watch and wait process? Well, one thing is that we know is that scoliosis is a progressive condition, especially in children as they're growing. And as they're growing, the curve has a high chance of progressing. However, it doesn't stop progressing as a child. It also, when you move into the adult phase, it's also going to progress. And this is because gravity is causing the progression over time. So when you're watching and when you're waiting, if the person's a child and they're growing, it can progress quickly. If they're an adult and not growing, they're progressing slowly, but they're almost guaranteed at some form or another that the curve is going to worsen. So you're just really wasting valuable time. And when you're wasting this valuable time, you're losing the opportunity to get the changes that you want to get in your spine. And there is something that's what I like to call a limitation, meaning when curves progress, we only can reduce it with conservative treatment, a percentage of that progression. So the cost of watching and waiting is not getting the ultimate reduction you could have gotten if you were to acted sooner. Now, once watch and waiting isn't effective, surgery is another route within the traditional approach that can also lead to negative outcomes. Well, traditional ideology is that surgery is really the only effective method in reducing scoliosis, which is something I totally disagree in. There are other methods that can be used to reduce scoliosis and to effectively manage a scoliosis over time. The issue is these traditional doctors are not really trained in this other type of outcome. However, surgery itself is associated with lots of negative outcomes. And number one, we know it's not a cure. So no matter what a scoliosis surgery does, it doesn't cure scoliosis, doesn't fix what causes it. It doesn't even guarantee that it would stop progression. In fact, there's several data out there that says that even after surgical intervention, the curve can still progress and they will lose the reductions that they will achieve resulting from the surgery. There's limited mobility. Obviously, surgery is fusion. They're using screws and rods and bone grafts to fuse the spine, to immobilize it, to try to stop the curve from progressing. And of course, so that limits the spine from moving. There's a possibility of increased deformity, meaning scar deformities. It can lead to more rib deformity. If they're removing ribs, it can lead to failed chest syndrome. There's a whole host of problems associated with going with such an invasive surgery. There's also the psychological effects of having to deal with this rod, the worry that something could happen to the rod. It could break. It can dislodge from the spine. It can lead to allergical reactions. There's whole things of being scared of what could possibly happen as a result of having that rod in the spine for the rest of your life. Infection's a very big concern when you're going through a surgery that's so invasive. And of course, increased pain levels post-surgery, unfortunately, can be very common as patients move into the adult stage with this surgery in their body. What could that possibly lead to? When you look at surgery as an adult, it's even all these complications I mentioned are even worse. They know the complications and the costs associated with a negative outcome in surgical intervention is much higher. It's a much higher risk surgery in an adult versus a child. So what are the costs of a conservative treatment versus traditional routes? Well, Scoliosis Reduction Center, the traditional route almost always leads to surgery at some point, where in the Scoliosis Reduction Center, our goal is to try to diverge that path where you don't end up with this invasive surgery. So first thing, let's talk about evaluations. Typically in a scoliosis evaluation in a Scoliosis Reduction Center, with all the x-rays and the evaluations and a consultation with myself and reviewing all the facts there, typically about $200 or $300. And that's in getting everything that we need in order to evaluate to see if you're a candidate to actually qualify for conservative type of treatment. With traditional type of care, normally you're looking at $1,000 or so for a consultation with a surgeon, and they're just pretty much going to say, yes, is your curve surgical level or not, and what's involved with the surgery. When it comes to in-office therapy, rehabilitation, and chiropractic care, typically at Scoliosis Reduction Center, roughly it's about $300 for about a 3-hour session, right? And the patient may get maybe 20 or 30 visits recommended over a period of time. When it comes to traditional treatment, this is not even offered. This whole step is completely skipped. There's no therapy, there's no rehabilitation, there's nothing done to try to influence the curve, especially when it's smaller and it can actually be influenced. When we talk about bracing, scoliosis braces in Scoliosis Reduction Center, these are customized braces. They're about 25 to 30% more than a standard poorly produced brace, but these things are custom, and most importantly, they're corrective scoliosis braces. They're designed to actually correct the spine to reduce the curve, not just try to hold it. In traditional treatment options, these are typically Boston braces is the most common form. Most of them are rapidly mass-produced braces that are slightly modified at site. They're a squeezing brace that just tries to hold the spine. And typically these braces are about $2,500 to about $3,000, and they're not as customized as a corrective brace. And again, the goal is just to try to hold it. So they're designed to hold and squeeze, not designed to correct and reduce. When it comes to home rehabilitation, Scoliosis Reduction Center, there's typically about $700 or so to $1,000 of home rehab equipment that a patient would have to invest into to actually use to help manage your curve during the critical times post-care, and also during critical times of progression that could possibly be progression, and also for adult cases to help manage pain and stabilize scoliosis. In the traditional approach, traditional scoliosis options, again, this is not even offered. It's not even something that's even recommended to do any type of home therapy or home rehab to help take control of your scoliosis. So when it comes to considering all the costs associated in scoliosis treatment, and when you consider the cost of a negative outcome, the cost of not getting treatment, the financial costs associated with traditional approaching versus a Scoliosis Reduction Center or conservative treatment, there's a lot of things to consider. Now, initially, to try to stop a curve from progressing, you may seem like you're kind of spending cost or spending money to try to stop a curve from progressing. But when you look at the cost of what a negative outcome, meaning that you don't stop the curve effectively and it progresses to a surgical level, and now you have to go through all this chance of having a negative outcome surgery, the cost is very small when it comes to treating a curve conservatively. And that's only at the moment. If you think about if the curve doesn't get reduced and that we can't prevent surgery and somebody has to go through surgery and they have to deal with a lifetime of a rod and what that could lead to and possible revisions throughout their entire life, the cost is great. It's great. And it's not only financial, it's actually physical and emotional and what it can lead to. So the best bet is always to reduce the scoliosis, to reduce the impact it has on your life, because with that, you can have the best chance of having a positive outcome with minimal cost associated with it. And we know conservative care costs less dollar for dollar in terms of degree of reduction that you can achieve. So make sure you do your research when you make a decision regarding your scoliosis treatment. And always, if you know you have scoliosis, consult with somebody who knows how to look at a scoliosis x-ray and to give you proper recommendations regarding making the proper decision for your health. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.